Well, good afternoon, everyone. My name is Larry Richardson, the President and CEO of the YMCA of York and York County. We are honored today to host this press conference of the Governor and the Lieutenant Governor and Dr. Levine to talk about health disparities. And I think this is an appropriate place. We've been working with vulnerable communities here at the YMCA for a number of years and have recognized health disparities to the point where we have a very active chronic disease prevention program, not just here, but YMCA scaled across the state. So we stand ready as a group of YMCAs and other kindred organizations in the state to learn what we can from the task force and to try to address those challenges and gaps that we see in the system. We're hopeful and we know that the donating community will help us achieve those necessary results because we know it's going to take a lot of resources. So thank you for coming out today, and I know it's warm, so I'm going to keep my comments very brief. I want to introduce a very special person who will introduce the Governor, Delma Rivera-Lido, who is on the YMCA Corporate Board of Directors and is the Diversity Education Specialist at Central York School District. She's also on the Governor's Latino Affairs Commission. She is on our corporate board and chairs our Diversity and Inclusion Committee, but her number one thing to fame was she grew up in this neighborhood and was a YMCA swim team alumni here at this YMCA. So that's her number one claim to fame. So my friend and our board member, Delma Rivera-Lido. Delma.
Thank you, Larry, and bienvenidos. Welcome, everybody that is here today. I consider myself extremely fortunate to be able to serve our community in so many ways, and I'm beyond honored to introduce Governor Wolf. I've seen firsthand the disparities that exist among many of our community residents. But the great work being done by the Governor's Advisory Commission on Latino Affairs, of which I'm honored to be a commissioner from York, and the YMCA of York, and the York County's new American Welcoming Center, has shown me that we can address these issues if we all come together. There's so much untapped potential right here in our neighborhoods, and I know that it will shine through if we unite, so that everyone, regardless of who they are or where they come from, gets the support and resources they need to live their best lives possible. Now I'd like to call up Governor Wolf, who I'm honored to serve on your Commission for Latino Affairs, who will help us start a conversation that will make a world where a healthy spirit, mind, and body is not just a possibility, but a reality. I'm honored to welcome Governor Wolf to York. Thank you.
So thank you, Delma. That was really nice, and I'm honored to have Delma on the commission. I've known Delma for a long time, and she has added a lot to the Latino Commission. I'm also really pleased to be back here at the YMCA. And Delma, I was really interested to hear that you were on the swim team. I was a swimmer here as well when I was in high school. So, yeah. Not a very good swimmer, but I was a swimmer. And Larry, is always, it's great to be here and be with you. But I especially want to thank Lieutenant Governor Fetterman and Giselle for being here. This is a really important announcement that Lieutenant Governor Fetterman is going to make. As Delma pointed out, we all need to work really hard to make sure that our society is as fair as it can be. Equality is a central issue. And it's near and dear to my heart, but it's also near and dear to the hearts of John Fetterman and Giselle. About a month after the first cases of COVID-19 were identified in Pennsylvania, I asked the Lieutenant Governor to chair a new task force that would identify differences in health outcomes depending on the different populations, and then to make recommendations to ensure that every Pennsylvanian, regardless of race, of gender, of ethnicity, or socioeconomic background, has an equal opportunity to survive and to thrive. And today, the COVID-19 Response Task Force for Health Disparity is releasing its report. Its chair, John Fetterman, is going to be speaking on that in just a minute. But it identifies 6 key areas of concern, not just health, but housing, criminal justice, food insecurity, education, economic opportunities, as well as health. Again, in just a minute, Lieutenant Governor Fetterman is going to talk about what these areas are and the recommendations that the group is making. But the point is that even though COVID-19 is in the task force title, you're going to note that many of the recommendations are looking at a much broader set of disparities that exist throughout our Commonwealth and throughout our country and have for a long, long time. So it's my intention to use the information gathered in this report as a basis for making lasting change. This cannot be a plan that ends up being shelved and that we just trot it out every once in a while. We have to actually do something now, and I think the time is right to do that. I've already made some reforms. I think we've talked about some good first steps that have been made. I eliminated prior convictions and salary history as requirements for job interviews in organizations that are under my purview. That's in the executive branch of the state, but also companies that work with the state. I've made significant reforms on licensing to our licensing boards so that things that used to be a disqualifier for folks looking for jobs and looking for careers that required licenses that had all kinds of insidious ways of shutting people out from those jobs, they are on their way out. They no longer exist. I worked with the legislature to pass law enforcement reforms designed to increase fairness. Again, first steps. A lot more to do, but first steps. And my commissions, including the Latino Commission, are reaching into communities that are providing on-the-ground assistance to make sure that what we do here is not just talk, that actually ends up changing people's lives. Recently, I established a steering committee for dismantling systemic racism, which is why it was so interesting to see what the Lieutenant Governor has come up with in his commission in this report. We're talking about a lot of the same things. And we can't just talk about surface issues. We have to get to the root cause of things. We've got to look at education, economic disparities, economic opportunities, disparities in that. We've got to look at a whole host of things that actually make it impossible for whole swaths of our population to live the kinds of lives we need them to live. We have to make sure that equity, fairness, equality, something that we all commit ourselves to in Pennsylvania. The problem is, if each and every one of us don't commit ourselves to fairness for everyone, we're potentially making this place, this Commonwealth, an unfair place for each and every one of us. At some point, if we can do this, if we can do bad things, and we can discriminate against anybody, everybody is susceptible, potentially, to be discriminated against. So we need to eliminate health disparity as part of this whole thing, but we need to make sure that we're addressing the broad issues, which is why Lieutenant Governor Fetterman is also joining this small group of cabinet officials and state officials working to make sure that we actually do the right thing to create a Commonwealth, from education, economic opportunities, to health, food, housing, all these things, to make sure that we're doing the right thing to make Pennsylvania a fair place. So I want to thank everybody who's working on this and who helped with this crisis. And now I want to turn it over to Lieutenant Governor Fetterman to talk about the report. Thank you very much.
Thank you, Governor, and thank you for being one of the first governors in the country to recognize that this epidemic was going to disproportionately impact these marginalized and vulnerable communities. You know, back in April, when the governor and I started this task force, we had a couple goals in mind. First, we wanted to be the communications from those on the ground working in those communities with the governor's office so we could pinpoint and assist with immediate concerns. And second, we wanted to work with stakeholders and the community leaders to create a report full of policy recommendations that would focus on health disparities in our communities that have simply been exacerbated by COVID-19. Which brings us to this moment today. As the governor mentioned previously, we've covered 6 policy topics in this report, but I will drill down a bit more on a couple of the very top priorities that the task force has put forth. As we head into this new school year, we need to ensure that all students start with an equal learning opportunity by standardized remote learning and access to technology. We need to work together to bring equitable internet access to all Pennsylvanians. Our broadband infrastructure is in dire need of reform. From the rural counties to cities as large as Philadelphia, not all children have access to the materials being uploaded by instructors, and some may not have been properly trained on how to use it. This also includes ensuring information and resources that are accessible to people with disabilities, both parents and students. And finally, we should ensure that we are acknowledging the language barriers that exist in some Pennsylvania families to provide the education tools and resources, such as ESL courses for both parents and other adults. In regard to the housing crisis, we need to assure that all Pennsylvanians will have housing security for months, if not years to come. And I want to thank the governor for taking action and extending the moratorium on evictions. But we all realize that there will be a day of reckoning. It will take families months, if not years, to recover from the economic downturn of COVID-19. The Commonwealth should seal evictions for Pennsylvanians who applied for unemployment during the pandemic under the current system, and eviction filing can follow a family around for their whole lives, creating hardships and uncertainty. The Commonwealth has and should continue to step in and make sure housing security is a top priority during the COVID crisis. And lastly, I would like to highlight one criminal justice issue that has a significant part in the health disparities within our community. Our task force recommended implementation of a driver's license amnesty program to correct an oversight that has left many marginalized Pennsylvanians with decreased mobility. Many marginalized Pennsylvanians have become lost in the vicious cycle of trying to restore their driver's license. Not having a valid driver's license can lead to poor health outcomes because it restricts one's from ability to travel to and from doctor's visits, pharmacies, grocery stores, etc. A lack of a driver's license also impedes one's ability to find employment, which leads to disparities, including access to health care. Reliance on public transportation can also lead to increased spread of COVID-19 in our marginalized communities. House Bill 80, introduced by Representative Jake Wheatley of Allegheny County, would help create this amnesty program, and I hope that it moves through the legislature to the governor's desk immediately. This bill could have bipartisan appeal because it keeps Pennsylvanians healthy and it helps folks become gainfully employed. Overall, our task force came up with 57 policy recommendations that are geared to tackling the immense disparities in Pennsylvania's marginalized communities. There's a lot of work to do, and there's a lot of Pennsylvanians continuing us to help them. I look forward to working with the governor, the administration, and the legislature on implementing these recommendations. I would like to close by thanking the task force members and the stakeholders for the important work that they put into this report. I will now turn things over to Dr. Levine. Thank you.
Well, good afternoon, and thank you, Governor Wolf, and thank you, Lieutenant Governor Fetterman. Health disparities and health equity have been a focus of the Wolf administration and the Pennsylvania Department of Health for a long time, actually, quite way before COVID-19 made it through the country and into Pennsylvania. We know that where you live is actually a major factor in determining your overall health. This pandemic of COVID-19 has actually magnified what we call the social determinants of health and the disparities that our communities face. In regards to the social determinants of health, those are issues that affect health, that impact health, we don't usually think of as health-related issues. From this lens, economic opportunity is actually a health issue. A living minimum wage, as the governor has proposed earlier this year, is a health issue. Education is a health issue. Housing is a health issue. Transportation is a health issue. As you mentioned, Lieutenant Governor, broadband access is a health issue. Nutrition, the environment, all impact one's health. In addition to working with the Lieutenant Governor's task force, actually we have a health equity response team within the department to work to find solutions to these issues related to COVID-19 and other health disparities. And one of the first issues is access to testing. We've been working with a great organization, the Black COVID-19 Equity Coalition in Pittsburgh, to develop a statewide group, a statewide effort that will help us look at regional testing approaches, particularly focusing on FQHCs, or federally qualified health centers. We have partnered with the Latino Connection in Lancaster to provide education, outreach, and testing to members of the Latinx community. And we are working on a faith-based testing strategy initiative to team up with local groups to make testing accessible, available, and adaptable for everyone. In addition to these efforts, we are developing educational campaigns about the importance of wearing a mask, washing your hands, social distancing, targeting specific minority and vulnerable communities, such as Black and African American communities and Latinx communities. Our actions as a community can lessen or worsen the impact COVID-19 has on our fellow Pennsylvanians. You answer the call to stop the spread when you wear a mask. You answer the call to stop the spread when you avoid large public gatherings. And you answer the call to stop the spread when you use hand sanitizer or wash your hands frequently. Pennsylvanians want to stay at work, and Pennsylvania children want to go back to school, but our actions as a community will impact the ability of us to do those things. So adapt your activities to protect against the spread of COVID-19, and always stay calm, stay alert, and stay safe. And now I'm very pleased to introduce the second lady, Ms. Giselle Fetterman.
Hi, I want to first thank the Y for hosting us and the incredible team. And if you haven't had a chance to visit their welcoming center yet, it's really remarkable and world class, and I hope you take the time to do that. Hola, soy Giselle Fetterman, soy una dama de Pensilvania. Sé que la COVID-19 nos ha afectado a todos de alguna manera. Esta pandemia ha traído estrés, incertidumbre, pérdidas y dificultades a nuestras vidas. Pero hay cosas que podemos y necesitamos hacer para mantenernos seguros a nosotros mismos y a nuestros seres queridos. Asegúrese de usar una máscara cada vez que salga de su casa. Las máscaras ayudan a evitar que propague la COVID-19 sin saberlo a las personas que lo rodean. Aunque las máscaras nos brindan cierta protección, no eliminan el riesgo de propagar la COVID-19 y no reemplazan el distanciamiento social. Necesitamos seguir reduciendo las oportunidades de exposición. Especialmente debemos evitar las multitudes y debemos seguir teniendo cuidado de no llevar la COVID-19 a seres queridos vulnerables. El 2020 no ha sido fácil. Sin embargo, estar socialmente distante no es lo mismo que estar solo. Pensilvania brinda apoyo a todos sus residentes, incluyendo los latinos. Y continuaremos apoyándonos unos y otros y superando esta pandemia juntos. I know COVID-19 has affected all of us in some way. This pandemic has brought stress, uncertainty, loss, and hardship into our lives. But there's things we can and need to do to keep ourselves and our loved ones safe. Please make sure you wear a mask anytime you leave your home. Masks help prevent you from unknowingly spreading COVID-19 to the people around you. Though masks provide us with some protection, they do not eliminate the risk of spreading COVID-19 and are not a replacement for social distancing. We need to continue to cut down on exposure opportunities. We especially need to avoid crowds, and we need to continue to be wary of carrying COVID-19 to vulnerable loved ones. 2020 has not been easy, but being socially distant is not the same as being alone. Pennsylvania supports all its residents, including Latinos, and we will continue to support one another and get through this pandemic together. And if I may have the governor join me. Thanks, Gov.
Thank you. Thank you, Giselle. I really appreciate those words. And we need to work together, all of us, to defeat this virus. That's the enemy, the virus that's out to get us all. And we're trying to do this in a way that allows our kids to get back to school as quickly and as cleanly and as safely as possible. So now I'll be happy to take questions. All of us will be happy to take questions. Ed.
Report. You've gotten input from so many sectors of the state. Would you give us perhaps a couple of examples in your mind, the areas that you have been especially sensitive to, where vulnerable communities, Black and Latino communities, have been severely impacted by the coronavirus?
Yeah, the death rate is higher among in the black community than it is among the community as a whole. You're shaking your head. No, that's true. That's actually true. And before the COVID-19 pandemic hit, the unemployment rate was higher. Schools are more racially segregated now than they've been, they even were before Brown v. Board of Education. We have a lot of work to do. And I think the pandemic, in terms of the health disparities, brought out just one more way life is not, we're not playing on a level playing field. And you can go into all the different reasons for that. But from stress to uncertainties, economic uncertainties, to families, to the criminal justice system, we have a lot of work to do. And so I think, as the Lieutenant Governor's task force showed, when you start to delve into the disparities that exist across the Commonwealth in terms of ethnic groups, in terms of socioeconomic status, sorry, in terms of who's affected by this, you come up very quickly with a whole set of things that goes beyond just the health issue. That's a canary in the mine. Yes, Dennis.
This might be for Lieutenant Governor as well,
Okay.
but you listed a number of policy topics: standardized remote learning, equitable infrastructure and broadband, language barrier, housing, criminal justice, the amnesty bill. Republicans are shouting at the television right now that, yeah, those were your policy things long before COVID. Can you tell us anything about what COVID specifically and why COVID specifically is hitting? And you are correct that it's the death rate is higher among African American people of color. But can you tell us what it is about COVID, and did your task force look into that is hitting those communities especially hard?
I'll let the lieutenant. But again, what the pandemic did was point out once again the vulnerabilities, the special vulnerabilities of certain populations, certain segments of the population in Pennsylvania. And if you look, there are all kinds of problems that have gone along with that. So I'll let Lieutenant Governor. This really was very quickly morphed into something beyond just health.
Yeah. And if the Republicans are yelling at the television, set, it's probably for some other things. It's not anything that we have said. Broadband access across Pennsylvania has always been spotty. And whether it's socioeconomic factors in, say, Philadelphia or in Tioga County, where broadband is still billed in many cases by the hour, where now they advertise you can have unlimited internet, you know. They're not far away from having those CDs in the mail that you used to get in the 90s to join AOL. I mean, it's woefully underfunded. And the fact that, as the governor's point, like whatever existed before the pandemic has been amplified by COVID-19. So if I don't know if you're implying that there was some kind of guided discovery or foregone conclusion. That just wasn't the case.
No, I'm just saying, so, and I agree, we reported on broadband access problems as people have to go back to school. It's a real problem. But that's not the reason that people are getting COVID in communities of color at a higher rate.
Of course. Well, another example is that overwhelmingly, our frontline essential employees are coming from these communities of color. You know, they work at the grocery stores, they work at the post office, they work on the front line, and they are disproportionately representative of that. And they live in neighborhoods that are much less likely to have access to proximate health care and any number of other issues. And the COVID epidemic has been a great amplifier of inequality. And that's what we've seen across the board. And I would just, you mentioned Republicans, I would just say, please, consider this driver's license amnesty. This is a jobs law. It's like you're much more likely to be able to get a job if you can get a driver's license. If you're not willing to raise the minimum wage, help make a person mobile who lost their license through nothing related to their actual driving skills or abilities or penalties therein. So it's a bipartisan solution that should have an innate appeal to both sides of the political spectrum.
Dr. Levine, in April you said that you were reminding medical providers that data on race and ethnicity were mandatory, yet I see that a lot of that data is still not showing up on the state health website. Can you tell us a little bit
Sure.
more about what's going on with that?
Absolutely. So you are correct. Actually, I ordered that a statewide order in the spring that race, ethnicity, and other variables like that should be added to all of the reports that we get in terms of laboratory results. Since that time, we have made progress, but not enough progress. So we started off with approximately 20 or 30% of the results had race. We're now at over 60%. But that's not good enough. We have to do even better. We started off with maybe 10 to 20% had ethnicity. Now we're up to about 40%. Better, but not good enough. So we need to continue to work with all of our healthcare providers, the laboratories, but also the people ordering the tests to make sure that they add those that information, that demographic information, which is so critical to us making the right decisions and to be able to understand our data. So we are continuing to message that. We're continuing to work individually with health systems and healthcare providers to do that, but we all need to work together, and they need to do a better job. Yes?
Specific numbers as to the racial breakdown? Which groups are specifically in order of most impacted?
Sure. I don't have specific quantitative data, but as the governor said, African Americans are adversely affected in terms of COVID-19. The Latinx community is adversely affected. I think that there are a lot of different reasons. As Lieutenant Governor said, many of our frontline workers, that includes frontline workers in particularly potentially restaurants, but also grocery stores and other stores that were considered essential, are members of that community and other vulnerable communities. Many of the people who do home health care are members of those communities. Many people who work and do basic work in our nursing homes and other long-term care living facilities and hospitals are members of those vulnerable communities and have been exposed. In addition, depending upon your housing opportunities, it's very hard to social distance if you live in a home with 20 other people. If you're in Philly or Pittsburgh or maybe even in York and you live on the street, how can you social distance? How can you practice the things that we're talking about if you have no home? And so I think that these vulnerable communities are adversely impacted. There is an increased rate of infection and in terms of mortality for these vulnerable communities. There are also other potentially biological issues and I'll give you an example. The pediatric condition, MIS-C, multi-system inflammatory syndrome of children. We have actually 42 children in Pennsylvania that have had this illness, and African American children are a significantly higher proportion of those in Pennsylvania and throughout the nation. We don't know why. We don't know why there should be a higher proportion of African American children that have this pediatric inflammatory condition as a result of COVID-19. Much to learn about this novel coronavirus.
My last question,
Sure.
Of all these recommendations, if you could pick the top two for you that you would like to see make a change in the way the state operates.
Well, I think in terms of the lieutenant governors, they all need. I'm not sure I can choose between the 6 categories and some of the ones. I'd go back to the ones that he highlighted. But from my perspective, we need to work on, again, the social determinants of health, and some of the things that we're working on specifically is testing, doing culturally appropriate contact tracing. If you have a contact tracer that contacts a Hispanic family and they're speaking English and they don't speak Spanish, you're not going to do a very good job in terms of contact tracing. So we have to have all of these factors in terms of our containment and mitigation efforts that are culturally appropriate. For me or the governor? For me, okay.
So, today in York County, we got 100 deaths. The case count has steadily increased as well. Are you concerned at all with the direction in terms of the numbers of where we're going in Pennsylvania and in York County specifically?
Well, overall, we have been making progress, and we have been bending the curve over the last number of weeks in terms of the number of new cases. Today, though, we had 991 new cases. That's increased from what we had over the last 2 weeks. We'll have to see. There was no particular data dump that is responsible for that increase, so we're going to have to see what the counts are tomorrow and over the weekend and into next week. We know that there is still significant community spread and community transmission of COVID-19 in Pennsylvania. Certainly the three counties that have the most number of cases are Philadelphia and Pittsburgh, Allegheny County, and Delaware County. But in every region of Pennsylvania, we have counties that are on our list, on our watch list, that we're watching some increases. Every region of Pennsylvania. Sometimes we know that there's a particular reason, a particular outbreak that is responsible for much of it, but to be honest with you, what we usually find is that there is community spread, which is why we talk over and over again about masks, about social distancing, about hand washing and using hand sanitizer, and those basic things that we all need to do to protect our communities and our families. I don't remember if it's on the list today. I know it has been in the past. There is no specific outbreak in York that is responsible. It would be particularly community spread. And we work really closely, and I know we even had a call this week with the York City Department of Health, and we collaborate all the time with our county and municipal health department partners.
I have two questions. This one is for you, Governor Wolf. Yesterday during a hearing, Representative Cox said that it's not the government's job to keep the people safe. Would you address that?
Yeah, I'm not sure he meant what it didn't come off very well. I think he was trying to say that life is a risk, and that we all have to, we all bear a certain responsibility. Of course, the reason we're doing all of what we're doing here is because the government does have a role to play in keeping people somewhat safe and reducing risks. We do have a role when it comes to inspecting restaurants. We do have a role when it comes to inspecting food and making there's food safety. We do have a role when it comes to making sure that workplaces are safe. We do have a role when it comes to making sure that our children and vulnerable populations are being treated appropriately. So I'm assuming he didn't mean exactly the way that came across. There is a role, a very strong role for government, and especially when you have a breakout of a pandemic, a crisis like this, it's incumbent on government. I mean, I think we've seen the results of all 50 states' governors, Republicans and Democrats, trying to make sense of this whole thing in the absence of leadership at the federal level. So there is a role for government.
My second question, as you all probably know, sports is still like the biggest thing we're hearing about from people. Everybody's concerned. We had viewers ask why Georgia was the example and not another state for when it comes to recommending not to have it.
I'm not sure that Georgia wasn't in my mind, and Pennsylvania has not made any directive. I was asked at the last press conference, I think 2 press conferences ago, what I thought about fall sports, and I said I would recommend that the schools don't start sports until January 1st. Now, my daughters went to the Northeastern York County High School through the public school system here in York County, and they were athletes. As a parent, now they've graduated, but the fall sport was cross country. And you'd think cross country must be one of those sports that you're the least likely to have a spread. But all of us parents would congregate at the finish line. The spectators, many as there were, congregated at the finish line, and that's a place for the virus to spread. I think what we ought to be focused on is trying to get our kids back to learning and to get an education. And anything we do that interferes with that in the short run, we ought to be careful about doing that. And so transporting people for whatever reason across county boundaries to congregate together for whatever reason, to the extent we do those things, whether it's a directive or a recommendation, to the extent we do those things, we make it harder and harder for our kids to get the education we need them to get. We need them to be in school. We need them to get back to learning. And every time we do something that interferes with that, we're doing all of Pennsylvania a disservice. So that's where that comes from. I also want to get back to something else that you said. All of Pennsylvania has had a resurgence. That's why we're doing what we're doing right now. We were in a pretty good place. I mean, we were down to 300, 400 new cases a day. And as the secretary said, we're now in 800 to 900 cases a day. And we've been higher than that. There's a resurgence in the summer. And so I took steps like with restaurants and bars to restrict access to those things. And they have had an impact. So we are actually having fewer and fewer cases. But all of this was caused because Pennsylvania did have an upsurge, and I think we need to be concerned about this. The guidance that we gave for schools, again, recommendations, it said that we will use all the information and make sure that you have it available, and we'll give you our recommendations. And we categorize different counties into 3 categories: low risk, medium risk, and substantial risk. Right now, the most of the counties are in the moderate risk. There's a big chunk, 20-some, that are in low risk, and there's only 1 in the substantial risk. I'm not sure where York County is. I think we're in probably moderate. Probably moderate. So we are looking at counties and trying to make sure that we're doing everything we can to help guide decisions that have to be made at the local level right now, which is to do with our schools. Yeah.
Follow up on what you just said. I've been told that you received a letter from the Pennsylvania Interscholastic Athletic Association regarding the issue you were just talking about, with them saying that they believe there remains a viable path to permit the fall season. And did you get the letter? Are you ready to respond?
I think I haven't seen it, but I think I did get the letter, and certainly we are in touch with the PIAA. But again, as I said in the answer to, I'm sorry, what's your name again?
Grace.
Grace. As I said in answer to Grace, we're trying to do everything we can to make sure that we get our kids back to learning. And I don't see how, transporting whatever level age population back and forth across county borders is going to help in the effort to mitigate this disease and get us back to learning. So let's put that on pause. The focus should be on learning. And to the extent anything that happens that interferes with that, I think we ought to be careful. Now, again, what I did was give a recommendation. I'm a parent. My kids went to school. My kids were PIAA athletes. And this is my recommendation. I also recommended that we, this summer, Pennsylvanians avoid going to the Jersey Shore. I'm sorry. That's my recommendation. You do what you want. And school districts are going to do what they want. This is my recommendation. It was then, it still is. Anything else? Yeah.
The PIAA has said that they don't want to go against your guidance at this time, that they want to meet with you, and they recognize it's a recommendation, but they're not willing to make that, to go against the recommendation at this time. What could they present to you that might change that recommendation? And do you have concerns that student athletes are already competing on the travel level in rec leagues without the same recommendations, guidance, safety measures that the PIAA would and has put in place?
Yeah, I do have concerns. And I'm not sure what they could say that would make me change my sense of what I believe is the right thing to do. Again, they have the decision to make on their own. I recognize that I'm just one person, maybe I'm the governor, but I'm one person that has an opinion on what we ought to do here. But I think anybody really looking at this and saying, okay, we have to sort of stage this reopening, getting back to life as we want it to be. And to do that, I would bet that it's going to require really a robust testing regime where we can get results quickly and where we can apply the test easily. And it's going to require contact tracing. We're building capacity in both of those areas and doing things, but we're not there yet. So we want to get back to life as normal. I mean, I think New Zealand has made a big deal that they're back to normal. They're dancing, going to movie theaters and all that kind of stuff, which is great. Not wearing masks, but they're an island and they can isolate themselves. We can't do that here in Pennsylvania, as the resurgence has shown. That resurgence didn't come because of stuff we didn't or did do in Pennsylvania. It's because people are coming in and bringing stuff from the Southwest and the West and up I-95 from the South. So I think, when I make a recommendation, I'm always trying to do the best thing I can. I'm thinking the best thing I can, but I'm sort of using my experience here as a parent saying, I'm not sure if I were setting out priorities for my family, I think I'd put education up there above cross country.
Though, wouldn't it be safer to have them in an environment that's controlled in a school where there already are masks, distancing, temperature checks and things like that, as opposed to if they don't have that opportunity and they go try and find it on their own in a travel program that's not regulated by anyone? Wouldn't it be safer to have these sports in schools?
I'm not sure. Yeah, I think we could develop a hierarchy of what's safer and what's perfectly safe is isolating yourself in your home. We don't want to do that. We want to get back to school. We want to get back to doing the things that are really essential for our citizens, our kids, ourselves. And I think as we develop that hierarchy, we ought to put the most important things at the top of the hierarchy and try to decide, make difficult understandably, decisions as to what might be less important.
Dr. Levine, if I could ask you a question on this front. We're getting a lot of questions from parents about what data is being used. Have you looked at the contact tracing or things of that nature, given the voluntary workouts that the governor authorized earlier this summer? Have you seen outbreaks because of those practices? And also, what are your concerns about student athletes being stuck at home? We're hearing from a lot of parents who are seeing a bad trend in their students. As a pediatric doctor, what are you seeing on that front that would concern you?
Sure. So there are a couple of different questions all involved. So first, the issue in Georgia that you mentioned was a specific article from the CDC in what is called the MMWR about a specific camp in Georgia where there was a lot of activities and there was widespread transmission and many kids got sick and lots of kids quarantined and isolated. And so that was the article, the specific article that I was referencing in terms of Georgia. And one thing I want to put out, the governor's recommendation included those recreational leagues that you're discussing. So it wasn't just a recommendation for PIAA, it was also a recommendation for those recreational leagues to suspend sports until January 1st. So it was comprehensive. And so we don't have a lot of granular data or quantitative data from the contact tracing. There hasn't been that much activities. There's been some, but not like we would see in the fall. And so kids aren't back at school and they're not in school sports. So I can't have the data about that until it would happen. There is data from some other states, as I was alluding to, but also we're making the same the recommendation that the governor has made based upon the same evidence that Penn State just canceled sports until January 1st, that the Big Ten just canceled all sports until January 1st, that the Pac-12 just canceled all sports until January 1st. And so it's the same data about the contagiousness of the virus, about the impact on children, which we are seeing in more and more states. The idea that children would not get sick from this is untrue, and children have gotten sick. Some children have gotten very sick, including the syndrome that I just mentioned, which can lead to heart disease and myocarditis and inflammation of the heart, and can have lasting effects. So the idea that children are somehow immune from this disease is untrue, that they can't have serious side effects from this disease is untrue. Also, children don't live in a vacuum. They come back to their parents, who are adults, who could get very sick, and then they have contact with other family members. And so, as the governor said, the priority is education. It's not sports. Governor.
Can I just ask, is it your concern about...
We'll do two more.
Your concern about cross-country, as you mentioned your daughters were cross-country athletes, was not about the cross-country athletes. It was about the spectators. And the PIAA has said they're willing to go forward without spectators.
I should defer to Dr. Levine on that. At least when my daughters ran, there were times when there were groups, clusters of runners, so they actually were close together.
I was just curious if there might be a path forward for low contact sports or things.
I keep an open mind. I made a recommendation, and again, that's the recommendation I would make to my wife, the two of us, if we made a decision on our daughters. And I think that's the way we ought to be thinking as Pennsylvanians. One more. Is this for me or for somebody else?
I'll go with Dr. Levine for this one.
That's great. Perfect.
In April, there was an outbreak in York County in the Latino community. It was traced back to a food manufacturing plant in Adams County. At the time, the state health department wouldn't tell us facilities where there were outbreaks. I'm wondering if that practice has changed because, as Lieutenant Governor Fetterman noted, a lot of people in the Latino community and Black community, they're frontline workers, and so it's very easy for an outbreak to spread through one employer. Will you be announcing publicly or sharing publicly at any time when there is an outbreak at a workplace?
So we usually do not announce the specific location in terms of privacy reasons. What we do is significant case investigations and contact tracing, and then if it's a food manufacturing site, then not only us but the Pennsylvania Department of Agriculture will be working with them in terms of isolation, quarantine, and how to go forward. In fact, we have made with the Department of Agriculture and Secretary Reding some specific recommendations and outlined some specific procedures that food processing plants and manufacturing plants can use. Excuse me. Yes, and we have provided significant advice in terms of the Pennsylvania Department of Education. Yes, and personal protective equipment to those facilities. But we don't usually talk about a specific place because it will break the confidentiality of those individuals. And so I know there has been criticism of the Disease Control Act in terms of that, but we still value privacy in terms of people's lives and their medical conditions, and we don't go out and announce that specific people or a specific house or a specific location has an outbreak of any disease because we do value that privacy, and I think others can understand that.
Internally, you're letting other workers in that facility
know?
Yes,
absolutely. So we work with the facility, so it's not that workers in the facility don't know, but because that's part of our case investigations and our contact tracing. So workers in the facility will know, but we don't announce it to the press because that can lead to stigma and discrimination.
Thank you very much.